Omeprazole, an in-depth guide to its uses, benefits, and side effects. Omeprazole is an incredibly popular medication used to treat a variety of gastrointestinal issues. It's used to treat acid reflux, heartburn, and other stomach-related issues, and is often seen as a go-to solution for those suffering from digestive discomfort. As with any medication, there are potential side effects and risks associated with taking it. This guide will provide an in-depth look into the uses, benefits, and side effects of omeprazole to help those considering taking it make an informed decision. We'll also discuss how to properly take the medication and what you should do if you experience any adverse effects. By the end of this guide, you'll have a better understanding of omeprazole and how it can help you manage your digestive symptoms. What is omeprazole? Omeprazole is a type of drug known as a proton pump inhibitor, PPI. PPI medications are the gold standard treatment for most cases of acid reflux. The main function of PPIs is to reduce the amount of gastric acid your stomach produces. The decreased acid production lessens the likelihood of stomach acid refluxing up into the esophagus and causing heartburn or acid reflux. PPIs are generally considered safe and effective for short-term use. They're typically used for 2 to 8 weeks. The problem is that most people take PPIs for longer than that. In fact, many people take PPIs for years. PPIs can be very helpful for short-term use, but when used for too long, they can lead to serious health problems, including kidney damage and vitamin deficiencies. Uses of omeprazole. Omeprazole is most commonly used to treat acid reflux, heartburn, and other digestive issues. It can also be used to treat ulcers and certain types of stomach infections. In some cases, it can be used to treat certain types of headaches and frequent urination. Acid reflux. Omeprazole can help reduce the amount of stomach acid present in your system. This can help reduce the amount of acid reflux you experience. Heartburn. Omeprazole can also reduce the amount of acid present in your system to help reduce the likelihood of you experiencing heartburn. Ulcers. Omeprazole can help heal certain types of stomach ulcers. It can also reduce the likelihood of developing an ulcer in the future. Stomach infections. In some cases, omeprazole can be used to treat stomach infections. Headaches. In some cases, omeprazole can be used to treat headaches caused by frequent urination. Benefits of omeprazole. Omeprazole has a number of benefits, including the following. Treats acid reflux. Omeprazole is a very effective way of treating acid reflux, one of the most common digestive ailments. Treats heartburn. Heartburn is another common gastrointestinal ailment that can be treated with omeprazole. Treats ulcers. Omeprazole can help heal ulcers in your stomach if you have them. Prevents ulcers. Omeprazole can also help prevent ulcers from forming in the first place. Treats stomach infections. Omeprazole can also be used to treat certain types of stomach infections. Helps prevent headaches. In some cases, omeprazole can help treat headaches caused by frequent urination. Side effects of omeprazole. While omeprazole is generally a safe and effective drug, it does come with some side effects. The most common side effects of omeprazole include nausea, abdominal pain, diarrhea, vomiting, diarrhea, and headache. Rarer side effects include liver damage, severe allergic reactions, and an increased risk of infections. Nausea and abdominal pain are the most common side effects and usually subside after a few days, as your body gets used to the medication. If you experience any side effects that are particularly bothersome, talk to your doctor about ways to reduce or manage them. How to take omeprazole properly. The best way to take omeprazole is with food. This will help minimize the likelihood of experiencing any side effects that may arise. If you take omeprazole for more than a few weeks, you'll need to get your blood tested to ensure you don't have any vitamin deficiencies. Vitamin B12 and intrinsic factor are two vitamins that are most commonly affected by omeprazole use. You should avoid taking omeprazole during or immediately before exercise. It's also recommended that you don't take it before bed. You should avoid taking omeprazole if you're pregnant or breastfeeding. You should also avoid taking omeprazole if you're taking other medications that are metabolized by the cytochrome P450 system in the liver. What to do if you experience side effects. If you experience any side effects while taking omeprazole, discuss them with your doctor. They may be able to suggest ways to reduce or manage them. If you experience any serious side effects, stop taking omeprazole and contact your doctor immediately. If you experience nausea, take steps to minimize it by taking the medication with food and avoiding smelly foods. Avoid taking omeprazole before bed to reduce the risk of it interrupting your sleep cycle. Avoid taking omeprazole before exercise to reduce the risk of it affecting your performance. If you're pregnant or breastfeeding, avoid taking omeprazole. If you're taking medications metabolized by the cytochrome P450 system in the liver, avoid taking omeprazole. Conclusion. Omeprazole is a common and widely used drug that can be very effective at treating acid reflux, heartburn, and other digestive ailments. It does come with a few side effects, though, including nausea, abdominal pain, diarrhea, vomiting, and diarrhea. When taking omeprazole, it's important to take it with food, avoid taking it before exercise, and avoid taking it before bed. It's also important to avoid taking omeprazole while pregnant or breastfeeding, while taking medications metabolized by the cytochrome P450 system in the liver, and while breastfeeding.